What should you know about cryptic miliary TB? Have you ever heard of cryptic miliary tuberculosis? This form of tuberculosis, or TB, is particularly important to understand, especially for older adults. Cryptic miliary TB primarily affects individuals over the age of 60. Unlike more common forms of TB, it often shows no obvious symptoms, making it tricky to diagnose early. Patients with cryptic miliary TB may experience vague symptoms. These can include gradual weight loss, fatigue, and general weakness. Sometimes, the liver and spleen may become enlarged, a condition known as hepatosplenomegaly. Interestingly, fever may be absent or only appear intermittently. Unlike acute miliary TB, which often presents with clear respiratory symptoms like a cough or night sweats, cryptic miliary TB can be quite subtle. This form of TB involves the spread of Mycobacterium tuberculosis through the bloodstream to various organs. While it can impact any organ, common sites include the lungs, liver, lymphatic system, bones, central nervous system, and adrenal glands. Depending on which organs are affected, specific symptoms may arise. Diagnosing cryptic miliary TB can be challenging. Because its symptoms are not specific, healthcare providers must maintain a high level of suspicion, especially in older patients who present with unexplained systemic symptoms. Diagnosis often involves a combination of clinical evaluation, imaging studies, and tissue biopsies that show granulomatous inflammation with caseation. A definitive diagnosis is made by identifying the TB bacteria through staining or culture. Recognizing cryptic miliary TB is crucial. Early diagnosis and treatment can prevent serious complications. If left untreated, this form of TB can be life-threatening. However, it typically responds well to standard antituberculosis therapy once it is identified. In contrast, acute miliary TB usually affects younger individuals and presents with more pronounced symptoms, making it easier to diagnose. Understanding cryptic miliary TB is vital within the broader context of tuberculosis. It highlights a less obvious, often overlooked form of disseminated TB that can significantly impact vulnerable populations, particularly the elderly. By being aware of its subtle presentation, healthcare providers can consider TB in the differential diagnoses of unexplained systemic illness. This awareness can lead to timely treatment and improved outcomes for patients. If you suspect you or someone you know may have symptoms, consulting a healthcare professional is essential for proper evaluation and care.